Good morning, everyone. Welcome back to the Trahan Therapy Center where we shape minds and change lives. This is your girl, Shanna Trahan, aka Shay T. Anyway, this morning I was just thinking about a topic that always comes up. People want to know if I'm struggling with mental health concerns, should I take medication? So let me go ahead and give this disclaimer. I am not a doctor, I do not have an MD, and despite that, I certainly have worked in multiple hospitals along with psychiatrists and nurses and have worked with many patients inside and outside the hospital in order to help them to reclaim their mental wellness. So, if I am a patient or a client who's seeing a psychiatrist or a therapist or nurse practitioner for my mental health concerns or a psychologist, should I be taking medication? First, I want to start off and say that that is a very personal choice. However, most of us live within some type of structure, be it a family, be it a work environment, or something where we typically have to work with and be near and around other people. One question is if I if medication is prescribed, and I've tried all sorts of therapeutic resources in the beginning to get well, and I have done the things consistently, and I'm still not seeing a change, if I don't take the medication, how is that going to affect my friendships and my relationships? If you don't mind a situation whereas you're not communicating with your coworkers or you're not communicating with your family and friends, then perhaps forego the medication, don't worry about it. Many people that you don't know in many different roles and positions on the earth and in the world, co-workers, family members, people that you consider to be friends, may already be taking some type of medication for a mental health challenge. In some circles, people discuss, hey, I'm going to a therapist, I'm taking this medication. In some circles, people just keep their things to themselves. And so you will not know. You say to yourself, boy, that person seems so well put together. Everything is cool with them most times. Well, the thing you may not know is that that person might already be getting some type of medicinal support. Before medications, and any of my clients can certainly tell you that in the beginning, if they come to me before seeing a psychiatrist, a psychologist, neurologist, or a nurse practitioner, that certainly I suggest things that they can begin to do themselves. And so that part is very important, not just hearing from a therapist, but working together to create a solid plan to help you to get out of your own way, if you will. Okay, so every person is different. I could have three people in front of me, all with, let's say, moderate depression with mild anxiety. And those three people might all be treated a little differently. One person might be able to get up out of bed and take a shower every day and manage all their personal needs and get to work on time. However, in the background, they're working with a therapist to not just maintain, but overcome the depression and move on to a happier life. Whereas the middle person might be the person that's not showering, that's missing work, and their treatment is going to be a little different. And then the third person might be a person who is almost not even getting out of bed or getting up late for everything and not showing up for appointments with friends or family, things like that, not brushing their teeth. Every person requires something different. So some people will need medication to support them and help them to be able to live a more stable life. And some people have said, but Shanna, there are side effects to medications. There are side effects to Tylenol. So when somebody tells me there are side effects to psychotropic medication, I tell them that there are side effects to ibuprofen. There are side effects to over-the-counter medication that you take every time you get a headache or a stomach ache or indigestion or other problems. So, how do you want to live? What do you want your quality of life to be? That should be a huge question that you answer. Some people will say, well, I don't like how it makes me feel. I don't like you know, yeah, I feel like I'm just so blah. Maybe it's just a little, maybe the dosage is a little too high. Who knows? But again, that's something that you would talk to your doctor about. Well, doctor, can we just lower it a little bit? Let's just see if I still feel. Some people said, I feel like a zombie, or I feel dead, or I don't feel really alive. So if you're experiencing this, talk with your healthcare professional, your physician or your nurse practitioner, your psychiatrist, and just say, hey, I want to take my medication because I want to live a better quality of life, have a better quality of life, be more stable in my life. However, when I do take this medication, I've been taking it now for a month and a half. This is how I'm feeling. Will that feeling ever go away, or can we just adjust the dosage a little bit? Because I want to take it, I want to stay on it to maintain my stability. So do talk to your doctors. Your doctors only know as much as you tell them about yourself. And so whenever you talk to your doctor, your nurse practitioner, your psychiatrist, your psychologist, it is important to be forthright with what's going on with you so that they can give you the best information. And if we only get 20% of the truth, if we only get 30% of the truth, then our what we're looking at in our evaluation can be flawed a little bit because you're not being straightforward. So it is important when you do get a therapist, a physician, nurse practitioner, doctor, psychiatrist, psychologist, that you are honest about what's happening with you. And if I see something that's off with my clients, I just say, hey, let's start with, go get your physical. Tell your doctor what's going on and get that physical. Maybe there's something on the health side that's not mental health related that maybe is causing these problems. So it's really important that you take care of your health from head to toe. Mental health, physical health, spiritual health, financial health. It's important to take care of your whole self. So back to the main point of this video, should I take medication? As I said, it's a personal choice, but just ask yourself, what would your quality of life be possibly with it versus without it? Who will you affect adversely with it or without it? Will it affect your income to take it or not to take it? How will it affect your income, your ability to maintain and be stable and grow your income and your savings in your future retirement and such? So all these things should be important to you. When I talk to the children of people who, if the parents had mental health challenges and it adversely affected the kids, question, how will I affect my children off the medication or on the medication? How will I affect them? Will it be a positive effect who I am on them, or will it have a negative effect on them? Taking medication is not just a you issue, especially if you have a spouse or family or kids, or if you work with other people. It's not just about you. It's about everything that encircles, well, you can't see my whole circle, everything that encapsulates that you're right in the middle, and then everything that's around you, your coworkers, your family, your neighbors, your friends, people at the grocery store, anybody you communicate with, it can be affected by you. So sit back, talk to your therapist, your nurse practitioner, your psychiatrist, talk to your family. Sometimes people are afraid of medication and, hey, it's going to do this to me, it's going to do that. But people are willing to take drugs, street drugs, but not take medication that's supposed to help you feel better. Every medication's not for everyone. If person A is taking medication, this one medication, that may be good for them, but maybe their brother is taking that same medication and it doesn't work for that person. They may need a different medication. So I would just say that if you do choose and you're starting at a lower dosage, that you can get the doctor to move it up if you're not realizing the changes in the benefits. But again, this is a conversation for you to have with your doctor. And sometimes people go into the doctor and they're not sure what to say or what they can or can't say. Remember, it's your doctor's appointment. If you have a question, if you have an idea, feel free to ask questions and to share. it's very important that you understand what is this medication that you're prescribing. It's going to be on you. The doctor might share a few of the side effects or things like that, but usually you can find that online, and also in the little white pamphlet that usually comes along with medications uh, from the pharmacy. So it's really important that you know the side effects. And oftentimes, your therapist might know the side effects as well. And if they see something that's not right or that you're reporting to them, often, I don't know about other therapists, I usually would say, hey, okay, well, I need you to get back with your nurse practitioner. That's one of the more serious side effects. So, but every person is different, guys. So just know that whatever you choose to be on the medication to help you with your mental health or to not, it can affect you, your family, your coworkers, your neighbors, the people in the community, anybody you communicate with. And the question is, what quality of life do you want to have? Thank you so much for being here with your girl Shay T. Many blessings for you and to you and your family. Talk to you soon. Bye now.